my name is Tobias and I'm a postdoc from the Department of Neuroscience here in Sheffield. And today I'm here on behalf of the organising committee for the departmental research meeting to interview Faith, who won the prize for the best oral presentation at this year's meeting. So if you'd like to introduce yourself.
Yeah, hi. I'm Faith Howard. I'm a postdoc in oncology and metabolism, and I work in a group which focuses on different techniques for tumour targeting. We use various nanoparticles to try and get our therapeutics into our target tumours.
Fantastic. Okay, that's great. And what did you present at the meeting this year?
So one of the projects that we're working on, it's Cancer Research UK funded, and we are using tiny nanomagnets as a way of getting our therapies into tumours following systemic administration. So by extracting nanomagnets from special bacteria, we then link them with our therapies and use an external magnet to drag our therapies into our tumours, and hopefully that increases their efficacy.
Yeah, that's great. Okay, and what were the key findings that you presented?
I mean, it's really exciting. It did show efficacy in our breast cancer models. That we got an increase in our oncolytic viruses as our therapy of choice in this study, and it did have an effective response in our breast tumours. And we also demonstrated that the oncolytic viruses stimulated an anti-tumour immune response. So this is kind of leading our work into different immunotherapies and trying to use them systemically rather than direct injection, which current clinical trials are mainly direct injection into superficial tumours like melanoma. So now we're advancing the use of immunotherapies to more disseminated tumours.
Fantastic. Okay, and so my next question was going to be really what the implications of these research findings, but I guess you've covered that. So yeah, no, it's excellent stuff. So are we talking, getting this into the clinic in the near term? Is it the long-term goal, or how close are we to?
Yeah, I mean, the nice thing about this therapy is, we already use magnets in the clinic. MRI machines, they're there, they're used on people, and they're ready to go. So the idea is that if we can get something licensed and actually into patients and use MRI machines initially, but some of the other avenues we're looking at are devices just to attach magnets to the surface, maybe a helmet for brain tumours. There's lots of applications for this in people, which is really exciting stuff.
That's brilliant. Okay, and just thinking specifically about the research project. So, what are the next immediate steps? Are you planning to write this and publish it into in a journal, or use it?
Yeah, I'm going through the really painful process at the moment. The paper is written; it's just getting it into the right journal. So, a few rejections in, but yeah, modifying the paper to go for some other journals now, and like I said, we're the next step is to use the MRI machines. So we used an external magnet, and now we want to try in our preclinical models an MRI machine. So it's really targeting metastatic cancer.
Brilliant. Okay, that's great. And finally, then, so what's the next stage for you in your career? So you're a postdoc at the moment. So yeah,
I am. Yeah, postdocing. I mean, the next step for me is the last year I've written a couple of fellowship applications and really trying to develop my own research niche. It's proving challenging. Obviously, the funding landscape's really difficult at the moment, but it's something that I really want to stay involved in. I've had a few years prior to this position in industry, which made me just realise that I want to be an academic. I love the blue sky thinking and just the creative process of academic science. So for the moment, I'm sticking to my guns, and hopefully something will happen by the end of the year. You'll see my own research group soon, hopefully.
Yeah, fingers crossed. Okay, that's all the questions from me. So best of luck with the fellowship applications, and thanks for taking the time to talk to me today.
Great, thanks very much.
Thank you.